Now, our first presenter for today is Jeff Skaggs. Uh, for this basically presentation, he's going to be focusing on the journey of recovery for women in Harrison County. And this is achieved through a transitional housing facility that is a Genesis house, and he will focus on that and how that came into being, and and how they work with the evidence-based practices in that facility, along with the combination of various different evidence-based programs which are involved in helping these women through their journey of recovery. So without further ado, we will move to our first presentation, which will be by Jeff Skaggs.
My name is Jeff Skaggs. I'm actually the Harrison County Alcohol Drug Program Director and also the coordinator for our local coordinating council here in Harrison County. Appreciate being able to be with you all today. I'm going to talk about a few things about what our LCC has done in Harrison County concerning the opioid epidemic and or drug use in our community. We get money basically to spend on DUI convictions and drug convictions in our county. It varies on how much we get, and we spend that money in three different areas. We spend it in treatment, in substance abuse prevention, and criminal justice initiatives. We have identified, based on our youth surveys, some issues that kids can get involved with, whether it's their risk and needs aren't exactly what they need to be. If we identify those and we help treat those, then their substance abuse issues, whether it be opiates or methamphetamine, even alcohol or marijuana, can be lowered. One of the things that we identified in our community was that Harrison County youth, compared to other youth in the state, did not believe that they were being recognized for making good decisions as opposed to other youth, again, in the rest of the state. And that we also understand that kids can be bullied into making decisions that they don't normally make. And one of the programs that we identified to help with that is called a pro-social norms campaign. So we created a pro-social norms campaign called Be the Majority. And basically, we're just letting kids know that according to their surveys in the school, most kids actually don't use drugs. Most kids actually don't drink. So if we can convince the rest of the kids who are kind of on the fence or being told that everybody's doing that, and educate them that actually, if you really want to join the crowd, the real crowd, the crowd that is actually not using is the majority. And we did that by sponsoring different sports teams, whether at the high school level and in the summer programs, little leagues. We had Be the Majority signs. We have a Facebook page that different youth get on there and talk about making good decisions. And we've had a lot of good feedback from that. And the other thing that we do as far as getting kids to being rewarded, so if kids making good decisions, they want to volunteer, then they get to be in a video. We also did a commercial at our local movies that ran during the whole summer. So some kids from all the different schools that were making good decisions and identified by staff were allowed to participate in that commercial. So you could go to the movies and see yourself in a commercial before the movie started. So that was really good. Opioids specifically, we've done a few things. An environmental strategy included providing a drug drop-off receptacle that was available for Harrison County citizens to get rid of unused, unneeded medication that use or other people that don't need it could get their hands on. So I know some counties don't have that availability, so they have to wait for particular drug drop-off days. I think they have 2 or 3 a year. But in Harrison County, you can drop off unused medications anytime you want at a Harrison County Sheriff's Department. Where they don't take needles, they don't take liquids, but you can get rid of all medicines there. And that was a great environmental strategy. To promote safe medication practices, we did work with a billboard company. We have a billboard that's really close to the main drag that all our school buses, the biggest school in Harrison County, South Harrison, passes. Their elementary, middle school, and high school pass that billboard every day. Parents taking their kids to school pass it every day. And that's just reminding parents to make sure that they're locking up their medications, that they're talking to their doctors about potential side effects, and making sure that we're just not taking for granted that medicine's safe just because a doctor prescribes it, that a kid or someone that's not supposed to be is going to have access to it. So we've gotten a lot of good feedback from that. We have seen in Harrison County our opiate problem kind of drop a little bit. Methamphetamine has been has made a big comeback. And one of the issues that we have found definitely during the opioid epidemic and back into meth has been a real true lack of services for women in our community. And treatment is sometimes not as easy as doing outpatient classes. It's not as easy as doing 48-hour stabilization period in a detox center. Even the 28 days we heard in the movie, 28 days is a good place to get started into a different level of treatment. But 28 days and then, you know, treat and street back into the community, back into the same attitudes and beliefs, the environment that you were around before is just the start of something that needs to lead to further services. And we, working in probation as alcohol drug director, we've always had a hard time finding services for women. Here in Harrison County, we have had to send women to neighboring counties for services such as transitional housing. Transitional housing is usually a 6-month minimum commitment where a client will stay there. They will do 12-step programming. They can get access to mental health treatment. They're drug tested. They're held to certain standards, and just try and give them to a longer period to change some attitudes and beliefs, to get some sobriety, to build that support system before they go back to where they came. And some clients decide they don't need to go back to where they came. So they'll, based on the resources they acquired while they were in the transitional house, they will just stay in that community in a different format. So in women specifically, it's just really hard to find services. We've had in Harrison County had to send women to Floyd County, Clark County, Madison, Indiana. We're pretty close to Louisville, Kentucky. So we have some clients there, but we just didn't have the services here in Harrison County for women. So a few years ago, our local coordinating council reached out and tried to get some of the local housing people that usually provide services for people providing people housing to get them to do this. It wasn't a good fit for them. So we just kind of looked in the mirror and says, hey, we've got to step up and do this. So we decided that we were going to move forward and open a women's transitional house, which is not something that a local coordinating council usually do. But that is kind of the commitment that we made a few years ago. And I know during this COVID-19, we're not doing things in person, and it's kind of crazy to think, but I'm actually presenting this conference in our women's transitional house. We opened the Genesis House in 2020. Our first residents are going to be coming here actually next week. It's been a long undertaking, but it's going to be an awesome program that's going to get to serve so many people. And actually today I'm excited to introduce Megan Stocksdale. She is our program director. I'm going to let her talk a little bit about transitional housing and women that suffer from opiate issues and other drugs. They need a longer period of stability and support, and that's what the Genesis House is going to do. So I'm going to move out of this chair and I'm going to let Megan come in, and she's going to talk to you about some of her experience and what she hopes to bring to our clients here in Harrison County.
Hi, I'm Megan Stockdale. I'm really excited to be on board to open this Genesis House. It's been a personal dream of mine for years. I've worked in this field for about 5 years, and I have just seen the lapse in services provided, as well as Jeff said. You know, we get them in a good spot and then we send them right back to where they came from. And unfortunately, a lot of those environments are not conducive to recovery. So to have a facility where we're going to be able to take these 14 women and we can teach them a new way to live, we can give them the skills. So it's not just about not using. Using is a symptom of the disease. It's about finding the root of that. Why do they use? And teaching them how to deal with trauma and with emotions, how to learn new coping skills. Some of these women may have never been taught how to budget their money, how to balance a checkbook, how to make a list and go to the grocery store and prep meals every week. They might not know how to do housework and maintain a house, or how to communicate healthy boundaries with loved ones and with employers. So we're really hoping to teach them how to fix themselves as a whole person, and not just dealing with the disease of addiction, but giving them these life skills so that way they can be successful and they can have long-term recovery. By fostering those skills, what we'll do is we will place women back into the community that are now going to be productive members of society. They're going to be going to work, they're going to be paying their taxes, they're going to be giving back, participating in school events, and it's just going to help the community to blossom and grow. And as we're able to witness women work through this program and become successful, my hope is that it lights a fire in other people, and that they're going to want to be a part of this change, or that they're going to want to change themselves, and it's just going to continue to grow and expand recovery. I've been in recovery myself for 10 years, and I've seen a lot of things. I've seen what works and I've seen what doesn't work. And if you follow a client, the longer you follow them and the longer you stay with them, the higher chance of success they have. So with us opening our doors, not only are we going to offer that 6 months where they're going to live here, but they're going to be alumni of our program. They're going to have an open door policy. We want them to come back and hang out on the couch and watch TV and eat dinner and come to meetings and mentor people. And that's just, you know, it's a part of this you keep what you have by giving away recovery aspect. And I'm really excited to incorporate that. So during that 6 months while the women are here, not only are they going to learn these life skills that we talked about, but they're also going to be involved in programming. So the women will do 12-step meetings, which is going to include Alcoholics Anonymous and Narcotics Anonymous, but they're also going to do some cognitive-based classes. So we want to deal with the thought processes and how to change that stinking thinking that got them into this negative criminal lifestyle in the first place, and give them some new ways to think. So we're going to deal with their attitudes, their beliefs, their morals. We're going to give them a different perspective. Going to get them to stop and pause and really use some tools before they just impulsively act out on things. And just because they've done something for 15 years, it obviously hasn't worked. So let's try something different. We really want to work through doing programming with them to teach them these skills, but then to give them opportunities to practice it within the house. So when different circumstances or events come up in the house, we want them to be able to actually use their tools and get comfortable using their tools while they're in a safe environment. Excuse me. So Genesis House is really, their slogan on the door is something near and dear to my heart. It says a place to heal. This is a safe place for them, and we want them to feel like they can come in and there's not going to be any judgment or criticism or negativity, but it's safe. They can be themselves. They can be true. I'm getting all flustered. Very passionate about this, but they can be 100% genuine who they are, and it's okay to make mistakes, and it's okay to mess up, and it's okay to have bad days, but we're going to deal with how we handle those bad days, and we're going to learn to apologize and to ask for help and to admit whenever we're wrong, instead of just packing up and leaving like they've done in the past. It's, you know, typical behavior that if you mess up or you're embarrassed or you're ashamed, that you're just going to run away and not deal with that problem. And I'll just use and I'll put another one on it, and then I don't have to look at this damage that I've caused, or this hurt, or this pain, or this embarrassment. Well, now you're going to have to face that, and you're going to learn how to do that, so that way you can be successful without using drugs or alcohol in order to numb that. And, you know, I feel like Jeff opened up talking about some of the stuff that we do with kids in the community, and this behavior is only going to roll down to these kids. So you now got these moms that are going to show up whenever they're supposed to be there, and they're going to follow through on their commitments, and they're going to be at their visitation, and they're going to go to the basketball game, and they're going to remember the birthday. And these kids are going to see, hey, my mom got better, and I don't have to deal with that, because if mom can do it, then I can do it. And I really feel like cousins and uncles and aunts and everybody is going to get to see the success of these women, and it's just going to multiply. And I can't express enough how excited I am about the program that we're going to have here at the Genesis House. There was a lot of legwork that went into this for them to make it possible. And the fact that this rural community was able to recognize the need and step up to the plate and say, you know what, we're going to be part of the solution. We know this problem, it's existed for years. Let's find a solution, let's be part of the solution, and let's make it happen. It's happening here, and it's going to bring great things. Hopefully we can check back in with you after we get our residents in here and we get them going. But, you know, we just hope that other communities across the state are able to see that they need that long-term support, and that they need to have programs in place to help them be successful to break that cycle of addiction and criminal behavior, and that it will only help better our state by continuing to add these programs into our community. So thank you all for your time today, and if you have any questions, please let us know.
Thank you, Megan. And you heard the door go off twice. We were getting a bed delivered from a furniture store from someone that donated a bed to us, and we're not even sure who that person was, but you know, we just really appreciate the support from our community, because people getting better, whether it's opiate addiction, methamphetamine, alcohol, drug, whatever it is, it's a community problem, and the community has to provide the solution. The Genesis House from the beginning has been a community solution, from the support from our local government to our local foundation to single people who have provided resources to get this house open. And then, like Megan said, I always say this is kind of a stone that you throw into a pond, and this big ripple is going to break out from where it went in initially, and it's going to change so many people's lives, and especially women who have their children who are counting on them, who are hopefully going to follow in the good footsteps now that their mothers are going to be modeling for them. So, but we appreciate your time today, and we really anticipate that we really encourage other LCCs and other organizations to do something like this. I know we were not. We were a little nervous to try something like this. It's not something that we usually do. We're good about doing little programs here and there and trying to move the needle with substance abuse. But, you know, this is going to be something we know that we're going to look back, and we're going to, we talked about having a tree, and then we're going to put people's initials who have graduated the program, and we just can't tell you how excited we are to think about down the road how big this tree is going to grow, and how many leaves are going to be on that tree, and how many people those people have touched. But they're our neighbors, they're our family, they're people whose kids go to school with our kids, and we're excited to bring this program of healing to Harrison County and encourage other counties to really see what needs that they have, and just take the risk like we did and provide this opportunity for people to get better. So, and we appreciate your time today, and we know there's going to be some questions, and we'll be looking forward to answer them at that appropriate time. Thank you so much.
Well, thank you, Jeff, and thank you, Megan, for that wonderful presentation and that program. Jeff and Megan, are you joining with us today?
Yes, I'm here.
Wonderful.
Yes.
Great. Well, I have a quick question for you. We also encourage those who have questions, please put those in the chat window, and we'll be sure to read those out loud, or if you'd like to unmute yourself, you can. But during we pre-recorded your presentation. I know you're discussing through your presentation the launching of the program. Have you had any residents move in yet?
We have. We currently have 7 women living at the Genesis House.
Wonderful. Wonderful. That's exciting. How's that going so far?
It's crazy. Every day is something different, but it's fun and it's a learning experience. Getting the women involved in community activities has really been near and dear to my heart. They've been doing craft nights once a week to work on a project for the prosecution office's Halloween event. And they have been participating in recovery walks. It's been recovery month. They've gone to candlelight vigils, and just really getting out there and showing them that as Harrison County, we do recover has been really great.
Wonderful. Wonderful. Well, we did have a question come in from Michelle, and she's asking, where is the Genesis House located within Harrison County?
I didn't know if Jeff was going to jump in. We're in downtown Cordon on Capitol Avenue.
Okay. Yep. And Jeff just typed in back in the chat. It looks like it's 500 Capitol Avenue, downtown Cordon, Indiana. Dr. Onward, did you have a question?
Yes, I wanted to ask you a question, like with this program, and I know that you want to grow it and you can have at least 14 residents at a time in your facility. But in addition to the recovery programs and some life skills training programs, are you also working with providing any clinical treatment to these individuals in any way?
Yeah, so we are partnered with Livestreams. So everybody goes for a mental health assessment within their first 2 weeks of being here. And then they also attend therapy twice a month. On top of that, I'm a KDAC too. So I do some counseling and case management with them. I don't document it as if it is, but I'm working with them whenever they don't realize it.
That's a good way to work with individuals, like giving them the help that they need without them even realizing. So that's a good thing. Another thing I wanted to ask you was that since this is, these individuals women are going to be in recovery, is there any interest from their end or from your end to also provide them with the peer recovery training or certification or anything like that long-term in their recovery?
Absolutely. So if that's something that they want to do on their personal walk, we would be happy to help them. One thing that we've just recently done is we're starting to partner with an organization called Thrive, and we will be having peer recovery support specialists working hours inside the house to help kind of coach them and train them and walk side by side with them. So they'll have access to that. They'll learn about what that looks like and how they can do that later.
That's wonderful. That sounds good. Do we have any questions from any audience?
Please, does anyone, I'll give a second of silence here for those who would like to unmute and ask a question, or please be putting those in the chat window for us. I've heard any. I guess I did have a question. Since you guys have just launched, what has been the biggest surprise or the biggest thing that was kind of unexpected for other people who may be starting a program like this that they may want to consider?
This is Jeff. I will apologize. I'm holding a 1-year-old if they try to answer your question before I do. The biggest surprise is honestly when we got started was the community support and the number of people that have been touched by somebody who has suffered from addiction. You know, it's kind of like the 2 degrees of Kevin Bacon. Like somebody knows somebody who's related to somebody who's had a problem, and especially women, because we obviously know that when women have issues, it sometimes affects children, it affects families, it affects a lot of people, and it's just amazing that the support that we got from the community, even our neighbors. You know, a lot of people are like, oh my gosh, I don't want a halfway house coming next to me. I like them, but not right next door. We've been, I felt like, supported throughout our community. Everyone realizes the need, and we kind of have that trust, which I know with a lot of, when you hear about things opening, we had a treatment center open next to our school and everybody was freaking out about that. And it's like, we didn't really have to deal with that much because people, they know us, they trust us, and they kind of realize the need in the community. And to me, that has been very surprising. I was expecting a little more people kind of complaining about, hey, what's going on here? All these jailbirds are going to be moving next to me, and what's going on? We haven't had any of that. And I just really appreciate the surprise of not having to deal with that. And like when we're doing that presentation, someone donated a bed, and we've had a lot of different donations and stuff that's really been supportive and helpful.
That's great to hear, and great to hear the community coming around the project.
Yeah, because I was going to ask you the next question as to how you prepared your community for this, but that kind of like answered my question even before asking that your community was very open. So if there is another rural community who's looking to open up a transitional housing for people with substance use disorder, what are the steps that they need to take, like the beginning steps? Can you guide them regarding that a little bit?
Yes, I mean, I think connecting with the LCC is real important because there may be some potential funds, depending on the size of the county, that are available for treatment or possibly justice services. Can you be used out of that? If they do have a local foundation, that's always good. We were at the time was dealing totally with a lot of female jail overcrowding, so it was just a win-win situation to approach our county leaders and say, hey, we would love to keep these people out of the jail, not just for the short term, but the long term. And that was their currency and helping them definitely see the wisdom and what this could provide our community. Stats, if you can talk to your local probation department about their number of people that they refer or that they know they would like to refer to a transitional house. I would try and get at least a level 2 or level 3 through house through instead of the peer runs houses are open. I think there's some benefit to peer run houses, but working in probation, there seems like there's a bigger benefit if there's actually staff in the home that can provide kind of like that that blanket of support and not let things get too out of hand for the people that are doing good if someone does end up relapsing. So that's what I would recommend. And Megan, I would definitely appreciate your chiming in here.
Yeah, absolutely. I totally agree. We went through what's called NAR, which is the National Association of Recovery Residences. And it pretty much says that we're going to meet certain standards and that we're going to make sure that the client's rights are protected while they're here. And that we're also going to provide them a certain level of care while they're here. Because we meet those guidelines and we're going to have that certification, it will allow us to be more credible to our referral sources for sure, but it'll also make sure that us as staff, any volunteers that we bring in, any alumni, that they're going to follow those same standards as well, and that we're going to protect the program so that there's not any room for error for people to push their own will on it, but rather that we're going to meet this certain guideline all the way throughout their programming and in the years to come. So I do think that that is, that's really important. You know, the other thing is just getting people behind you that are passionate about recovery and change. The more voices you have that say, hey, I've got 10 years clean and I'm a valuable, productive member of society. I go to work, I do this. The more people that you can get on board shows people that change is possible and it's not all for nothing and it won't just be a revolving door. And get their voices heard, get them involved. They want to help. They want to volunteer their time. They want to step up and be a part of this. So just opening that door and providing that opportunity can get you some sound people that you can trust their direction and where they believe recovery is going to happen.
Thank you so much. There was a lot of valuable information and names that should be considered when you are actually trying to set up a transitional housing in your community. Thank you so much, Jeff and Megan.
Yes, thank you so much for being with us. And if you have questions to our audience as today's programming goes on, please don't hesitate. We can definitely connect with Jeff and Megan and get those responses back to you. So thank you, Jeff and Megan.
Thank you.